So Kim, thinking about the concerns for gestational diabetes, how is that different from type 1 and type 2? Can you kind of explain the differences?
Sure, absolutely. Gestational diabetes is a type of diabetes that only develops during pregnancy in women that already don't have diabetes. So it's brand new. It usually develops between the 24th and 28th week of pregnancy. So there is a screening for that at that time, all depending on the woman's risk factors, which we can go over later.
Mhm.
In the United States, probably about anywhere from 2 to 10% of pregnancies are gestational pregnancies. And it occurs when, due to the hormones of pregnancy, the body isn't able to use the insulin as effectively as it should. And so the blood sugars rise during the time of increased insulin resistance, which is usually closer to that third trimester.
Mhm.
Now, type 2 diabetes is different in that it is obviously diagnosed before the pregnancy even occurs. Women with type 2 diabetes are usually diagnosed when they're adults and commonly are prescribed diabetes pills to help control their blood sugar, although that may progress to insulin or injectables later on. Um, Type 1, also diagnosed prior to the pregnancy. Women with type 1 diabetes are usually diagnosed in childhood or young adulthood. And in their situation, they produce little or no insulin on their own. So at diagnosis, they're prescribed insulin, and those insulin needs usually increase tremendously during pregnancy due to the hormone changes.
Mhm. Mhm. Is it possible for someone to be diagnosed with the type 1 or type 2 while they're pregnant, even though it didn't really start then? But
It
the
is
diagnosis?
possible. It
Yeah.
does happen. Although sometimes it can be difficult to tell because gestational diabetes is the definition of it is any glucose intolerance during pregnancy.
Gotcha.
So the main thing is treating it appropriately, and all depending on how the blood sugars are doing depends on what treatment is used.
Mhm.
If most women are able to manage it with some dietary changes
Mhm.
and physical exercise can really tremendously help blood sugars. Some women do require medication of some sort.
Mhm.
Gestational diabetes does usually go away after the baby is delivered. But because there is a small chance it remains, or if we're unsure that this was a pre-existing diabetes situation before
Mhm.
pregnancy, the OB will usually do a glucose tolerance test again about 6 weeks postpartum just to make sure everything is back to normal.
Yeah, the reason I had that fetal echo was because of gestational diabetes. So I'm familiar with this process of retesting after. Nobody loves doing the glucose drink tolerance
No.
test, but it's definitely helpful for identifying what's going on. So for those moms who have type 1 or type 2 diabetes, what should they know prior to starting a family? What should they know about while they're pregnant? What advice do you have for them?
Right. Well, something about diabetes as a whole is planning is the key to having diabetes, and certainly when you're planning a pregnancy. Good planning is the key to a successful and safe pregnancy. So they should visit their diabetes provider about 3 to 6 months before the pregnancy. They should have a complete physical exam, be checked for diabetes complications, and may need treatment for those complications before considering pregnancy. With the medications that are used for both type 1 and type 2, sometimes those are contraindicated in pregnancy. So sometimes their diabetes medication regimen will need to be changed even prior to the pregnancy. And most importantly, the blood sugars need to be in excellent control prior to conception because the organ development of a fetus occurs very early on in pregnancy, oftentimes before you even know you're pregnant. If the blood sugars are elevated during that time, there's an increased risk of complications or birth defects that could potentially occur. So having excellent control of blood sugars prior to conception is one of the most important things that can be done.
Mhm. It sounds like having that meeting ahead of time, pre-planning when possible, can
Yes.
help a lot.
Yes. And we do have preconception um, counseling appointments available for anyone that's considering becoming pregnant that has pre-existing diabetes.
Yeah, definitely optimizing your health, and then also like making sure that the meds you're on are all going to be ones you can continue while pregnant. So yeah.
Correct.
So Dr. Engel, did you have anything else to add about diabetes during pregnancy?
I feel like a common misconception for people when they do hear, oh, they have diabetes is that a big baby, right?
Mm-hmm.
And while it is a risk for diabetes, another common risk that can happen with uncontrolled diabetes is actually fetal growth restriction. So we're on both sides of the spectrum here, where we can have a too large baby, and we can also have, just because of the vascular disease, diabetes is a vascular disease, that it can affect the actual growth of the baby. And then also just reiterating the importance of blood sugar control. I feel like, some people may just use the insulin as, the medication to help with their blood sugars, and maybe not do the diet modifications as much, but just keep in mind, the biggest thing that we are concerned about when the baby is born is not if they're too big, not if they're too small, but really if they've been living in such like a high glucose environment while pregnant, puts them at increased risk for hypoglycemia when they're born, which in turn meaning you could have a full-term baby, but they end up in the NICU because of that.
Mm-hmm. Absolutely. Yeah. Dealing with this with my pregnancy with gestational diabetes, I was very dedicated to that prescribed diet and making sure that I kept on it. And then adding in the exercise. It was something that that Kim added, and that was a huge help. And so those things definitely assist. So I love that you're highlighting that, and also the risk for baby. So keep them healthy.